So we have a bit of a grab bag of a few things today. So since yesterday was actually Orthodox Christmas, we can celebrate this as opening our Orthodox Christmas presents of information. So the first thing to talk about is just a status report of where we are. I think obviously the mood in the calls has been certainly more optimistic the past month since we've been seeing lower case counts, and obviously that's good, but still important to keep in mind that our overall cases per day per capita are still roughly where they were at the end of October, beginning of November, which at the time we thought was horrendous. And so keeping that in perspective, I think is important. Also important to understand that we are still rocketing skywards in terms of deaths per capita as we've been following. These are the spaghetti curves for total cumulative deaths per total population. And you can see that many of the Midwestern states are now surpassing the deaths per capita toll that the Eastern states achieved from the spring wave, which was seen at the time as catastrophic levels of mortality. North Dakota and South Dakota are now rocketing towards the top in terms of states, second only to New York and New Jersey and Massachusetts, and we'll pass those soon, I believe, and we're down here now approaching 1,000 deaths per capita. So that means that 1 out of every 1,000 Nebraskans has died of COVID-19, not 1 out of every 1,000 infected. That's 1 out of every 1,000 Nebraskans. And that number, as you can see from the trajectory, is going to continue going up. The next thing I should put it on presentation mode here. The next thing to talk about is a study that came out recently looking at convalescent plasma therapy in Argentina. This is an important study, not only because they have really cool graphics, which I thought was a clever way to describe how the study was done, but because I think it reinforces the notion that effective antibodies and high titer convalescent plasma are effective therapies early in the course of infection. So the difference in this study and the others that have looked at convalescent plasma is that they prospectively identified plasma, and you can see this here on the left, that had high titers of antibodies. Now that was using a specific antibody or serology assay that they developed there, and so that's not necessarily easily translatable to other antibody assays, although they did correlate that with neutralizing antibodies. But nevertheless, important that they only used convalescent plasma that had an IgG titer of greater than 1 to 1,000 in their assay, and then identified patients who were ill but before they developed severe disease, and then randomized them to receive either placebo or convalescent plasma. So it was a double-blinded randomized controlled trial. And then ended the analysis early because recruitment and enrollment at the time in Argentina was low, as the cases were dying out briefly during the summer or their winter, at the end of their winter. And then analyzed those data in the interim with about 80 per group. And what they found was a significant difference in people who developed their primary endpoint, which was considered the advancement of severe respiratory disease. So essentially for us, that would mean people who would probably need to be in the hospital requiring oxygen therapy. And you can see the difference was 31% in the placebo group compared to 16% in the convalescent plasma group, achieved their primary endpoint of probably requiring hospitalization. So that's a pretty big difference. That's almost a 50% reduction in incidence of development of hospitalization requiring disease, and you can see that the absolute difference of 15% means about a number needed to treat of 7. And you can see here that they also were able to correlate the titer of antibodies in their product with better outcomes. So as I mentioned, all of these convalescent plasma products had a titer of IgG of better than 1 to 1,000. But when they broke down the analysis to look at plasma that was above the the mean concentration versus below, plasma above the mean concentration performed even better. As you can see, only an 8% achievable of primary outcomes. So it seems to lend weight to the idea that early in the course of illness, convalescent plasma or other antibody products, which we're seeing with our monoclonal antibody from Lilly and Regeneron, that can be effective. And I wish that folks in the US had done approaches like this with randomized clinical trials of plasma products that had been validated as having high titer, because I think we could have made a bigger impact versus what appears to be the case in the studies that have looked at non-titered convalescent plasma. You just don't get a reliable response to therapy, and it's not worth the time and the effort. So the next thing I wanted to talk about was a study that came out in JAMA a couple of days ago, looking at seroprevalence for COVID-19 in the US. This is looking at all of the CDC's data up until the middle of November. And it just reinforces some of the things that we've discussed before, which is the fact that when you look at serology, you find that we are missing the vast majority of cases. They are not being detected and reported by laboratory infection. And it allows you to understand the true burden of disease and also things like what's the true hospitalization rate and infection fatality rate. And so it shows you kind of the iceberg here that's represented by this triangle. At the top are deaths, which we recognize most easily, followed by hospitalizations and reported cases. But it's true that the actual burden of the disease, that's the iceberg under the water, is much higher. And they estimated that by the middle of November, the US had actually seen about 47 million infections, and that correlates with about 14% of the population. And if you think about, we're almost 2 months out from that, and these data probably have a bit of a lag of seroconversion. So this is probably a snapshot from the beginning of November. We're, I think, tracking with probably more than 20% of the entire country now being infected, maybe 25% at some point. And that correlates with the numbers that we talked about for Nebraska. That also would mean that our under ascertainment or under reporting factor is about 3, which is what we had talked about estimating in Nebraska in November or so. Also means that the overall infection fatality rate, so of the total number of people who are infected, symptomatic and asymptomatic, about 0.6% die, or an IFR of 0.6%, and that's again about where we had been pegging things. So not necessarily surprising findings, but good to see that there's objective evidence that now continues to support where many of us have thought the pandemic was and where our trajectory is going. So I think that's all we got for today, and happy to answer any questions.